Hey, this is Dr. Green with Momenta Chiropractic, and today we're going to talk about the single leg hip hinge and take that into what's called the single leg RDL or Romanian deadlift. So a hip hinge is essentially being able to flex the hips to send the hips back, which starts to engage the hamstrings, glutes, and really the whole posterior chain. The difference between a hinge and a squat is in a hinge, the focus and emphasis is mainly on hip flexion and hip extension. A squat, we get hip flexion and knee flexion as well. So it helps to isolate where there's a soft bend in the knees, but the action is truly coming through the hips. And this helps to kind of associate with exercises like the deadlift, kettlebell swings that are hinge focused exercises. So when we talk about the single leg hip hinge, it's a little bit more of a stability challenge because it forces us to have to balance on one leg. So the action is the same, we're just doing it in a single leg stance. So if I were to focus on that right side, the movement is going to be the same where my hips go back. I'm just going to lift that front leg, stabilize the core by getting a little bit of a breath in, and then I'm going to think about keeping my leg and my torso in the same plane, sitting my hips back, shifting weight back slightly towards the heel so I can make sure that I feel it mostly in the glutes and the hamstrings, and then using the glutes and the hamstrings to extend the hip and bring myself back up neutral. So one more time, a little bit of a breath in. I'm going to sit the leg back, keep hips level, shift weight back slightly towards the heel to feel my hamstring and the glutes, and then use those muscles to allow myself to come back forward. So there are a few things that we see in terms of errors with this exercise. One of them is not kind of getting flexion through the hips, but getting rounding in the back, and that would kind of look like this. We're letting our torso kind of round forward. We're not getting much of like a hip hinge as much as just kind of bringing the torso over the floor. So instead of that, what we want to think about is being able to keep our leg and our torso in line to allow the motion to happen at the hip instead of the low back. So as I sit back, I should be able to kind of keep those in line, and that helps to really emphasize movement of the hip rather than the low back in this position. The other thing that we tend to see is a little bit of rotation, or we lose tension in the hip and we start to open up. So I'll show you from the back. So if I were to sit back, I want to be able to keep my hips level. Sometimes what we see is we will open up because it's a little bit easier because it decreases tension on the hip. So really we want to be able to keep hips and shoulders level so that we're really emphasizing good movement through the hamstring and the glute and keeping things in line in that way. If we want to be able to add load, what we like to do is place the weight in the opposite hand of the stance leg. So if my right leg is the one that's working, I'm going to hold it in the left. And the way that we know that we're doing this right is instead of coming forward and having that weight drop in front of us, we're going to sit back, and that weight should drop right along like the inside of my foot, and then I can pull back. And so that would be what would be considered a single leg RDL, where we're adding weight in a Romanian deadlift style, right? We're just kind of letting that weight pull us down, controlling the motion, and then driving right back up, and really kind of working that posterior chain on the down leg. So that's the single leg hip hinge and the single leg RDL. Very challenging movement, but you can get it down. Just remember to maintain a little bit of that weight shift back and make sure that leg and torso stay in line, make sure the pelvis stays neutral, and then give yourself time to practice and make sure it works. So if you have any questions on that, just let us know.